I am a consultant hematologist. I specialize in the diagnosis and treatment of blood and bone marrow disorders. The aim of this short film is to provide some basic information about chronic myeloid leukemia, or also known for short as CML. A new diagnosis can be overwhelming, and it can be difficult to take in all the information given during the first consultation. This short film will hopefully give you the core facts about what is chronic myeloid leukemia, the symptoms and signs of chronic myeloid leukemia, the tests and investigations required for the diagnosis of CML, and the treatment options available for this disease, and also some brief advice on living with chronic myeloid leukemia. I hope that following this discussion, you will be empowered with a better general knowledge of chronic myeloid leukemia. This, together with a strong relationship between you and your treatment team, will make things clearer to you and your loved ones. The word leukemia means too many white cells in the blood. There are various types of white cells in the blood, but these can be broadly divided into myeloid cells and lymphoid cells. Chronic myeloid leukemia is a bone marrow disorder where the bone marrow produces too many myeloid cells, leading to a very high white cell count in the blood. The abnormal cells also accumulate in the bone marrow and interfere with the production of other normal blood cells. A lot of research has been done on this disease. These studies have shown that the leukemia cells in CML have a specific abnormality referred to as Philadelphia chromosome. This is a unique characteristic of CML which appears to drive the disease. The Philadelphia chromosome leads to the production of an abnormal protein called BCR-ABL. You're not expected to know the details on these, but I mention them as you're likely to hear about them during your diagnosis and treatment. It is important to remember that chronic myeloid leukemia usually is a slowly progressive disease and often develops gradually over months or years. It should not be confused with acute leukemias, which are different type of diseases with a more aggressive course. As CML develops slowly, the majority of patients with CML may not have any symptoms during the early stage of the disease. That is why it is often discovered by chance when patients have blood tests done for another reason. As the abnormal leukemia cells accumulate in the bone marrow, they interfere with the production of other normal blood cells and may lead to anemia. Another common feature of CML is gradual enlargement of the spleen, which is caused by the leukemia cells collecting in the spleen. Over time, the spleen may become quite enlarged and create a sense of fullness in the tummy. Therefore, someone with CML may present with symptoms like tiredness, weight loss, and reduced appetite. The overgrowth of leukemia cells in the bone marrow will spill into the bloodstream. In some cases, the very high white cell count may make the blood thicker and can cause symptoms like headaches and even visual disturbances. The diagnosis is suspected when someone is found to have a high white blood cell count and/or an enlarged spleen. The next step is the examination of the blood film under the microscope by a hematologist. If the suspicion of CML is confirmed on the blood film, specialized tests like BCR-ABL abnormality are done, which can confirm the diagnosis. A bone marrow biopsy is also required to perform specialist tests for Philadelphia chromosome and BCR-ABL quantification to assess the disease burden. The bone marrow tests enable your hematologist to define the extent or phase of your disease and plan treatment. There are 3 stages or phases of this disease. The chronic phase is when the disease is still in a stable phase without any features of disease progression. Majority of CML patients are found to be in chronic phase at the time of the diagnosis and may remain so for a long period of time. When the disease shows some features of progression, it is referred to as the accelerated phase. In a small percentage of patients, the disease may begin to transform into an acute leukemia pattern, which is referred to as the blast phase. Additional tests may be requested to complete the workup before starting treatment. These can include blood tests to check the liver and kidney function, a chest X-ray, and an ultrasound of the tummy to assess the spleen size. With the advent of a group of drugs called the tyrosine kinase inhibitors, or TKIs for short, CML has become a very treatable disease. The first of these medications has been used since 2001, and there is a lot of cumulative experience with them. Moreover, in the recent years, more potent TKIs have been developed and are now available for the treatment of CML patients. The treatment for CML is based on the extent or phase of the disease, in combination with the assessment of comorbidities and a prognostic score calculated by a hematologist. For 85 to 90% of patients, the disease is in the chronic or stable phase, and the TKIs are the treatment of choice. The selection of the specific TKI medication is also influenced by presence of other risk factors like cardiovascular risk factors. TKIs are given in a tablet form, and great majority of the patients will respond to the treatment with blood counts normalizing within few weeks. As TKIs are very effective medications, the aim of the treatment is not just normalization of the blood counts, but also correction of the key abnormality represented by the Philadelphia chromosome. Therefore, your hematologist will monitor your response with special blood tests and adjust your treatment as required based on these. Your treatment team will also educate you and monitor you closely for the side effects of your treatment, and you must maintain a regular communication with them. Where side effects are intolerable or the disease response is less than satisfactory, your treatment can be switched to a different TKI. This will be decided by your treating hematologist as part of the monitoring process. About 10 to 15% of the CML patients may present with an accelerated phase, which may lead to the blast phase. Accelerated phase of the disease is also treated with TKIs, but higher doses are required. As this represents more advanced stage of the disease, your hematologist will also liaise with a center that specializes in the management of CML to establish a plan for your treatment. Patients who have developed the blast phase of the disease usually require more intensive chemotherapy in addition to the TKIs. This will be explained to you in more detail by your hematologist. The success of the TKIs mean that most patients of CML have a good life expectancy, provided a satisfactory control of the disease is achieved. Also, the TKIs are fairly well tolerated by the majority of patients, allowing them to continue with long-term use of these medications, ensuring the disease remains under control. Therefore, majority of the CML patients can have a normal day-to-day life. It is, however, important that you maintain a close relationship with your hematology team, allowing them to regularly monitor your disease and to support you. Also, maintaining a healthy lifestyle, a balanced diet, and drinking enough water is in your best interests. It is important to remember that TKIs are very smart drugs that have revolutionized the treatment for CML, and also that there are even more of such drugs in development which will further improve the outlook of this disease.